about the video station infantile spasm. So, what is the description of infantile spasm video stations? It's like a salamata, sudden outstretching of the upper limb with flexion of the both lower limb and bending of the trunk. Remember, there is sudden outstretching of the upper limb, there is flexion of the lower limb and bending the trunk. That is, so it is a case of abnormal movement. What are the deficient diagnosis we can keep? First of all, like infantile spasm in infantile colic, Sandifer syndrome, West syndrome, benign myoclonus, exaggerated startle reflex. Types of infantile spasm are flexion, extension, mixed, and West. Considered as an emergency situation as it can cause serious brain damage. So remember, it is a case of abnormal movement. We are keeping the DD infantile spasm, infantile colic, West syndrome, Sandifer syndrome. These are and like exaggerated startle reflex, benign myoclonus. These are. So remember, these are type of infantile spasms are flexion, extension, mixed, and West, and it is a very serious condition because emergency condition it cause serious brain damage. Now, what are the history we ask? First of all, onset, course, and duration. What make it better and what make it worse? Is it first time or recurrent occur? Is there any video recording available or not? What happens before or during or after? Loss of consciousness, eye blinking, starring, rolling up, apnea, tachycardia, cyanosis. Then about the relation of the feet, history of aspiration and choking. So in relation to the feet, a history of aspiration and choking because of Sandifer syndrome, we keep DD. We ask any stigmata, any skin stigmata and cardiac symptoms as tuberosclerosis associated with infantile spasm. So any skin stigmata. Now perinatal history, any birth history like diabetes mellitus of mother, withdrawal, drug withdrawal, decreased vitamin D in diet, natal history, fast cry, resuscitations, infant of diabetic mother, postnatal is fever and trauma. Any family history of the same condition. So any family history of same condition. Now I'm going to what do you want to examine? Airway, breathing and circulation, ABC, GCS, Glasgow Coma Scale, vitals, heart rate, respiratory and blood pressures, oxygen saturations, apnea, alarm, hydration status, entry fontanelle, full neurological examinations. Remember, it's a full neurological examination we do and assess the vision and hearing, development, head size, shunt, cardiac, abdomen. So vision and hearing assessment and development as development affected if it is tuberculosis associated with that head size because VP shunt present or not any cardiac problem also abdomen. Now investigation EEG we do we find hips arrhythmia. So investigation we are doing EEG hips arrhythmia MRI of the brain ECG and echo urinary electrolyte renal function test abdominal ultrasound and Doppler. What is the treatment of infantile spasm? In tuberous sclerosis, vigabatrin, visual field defect, in West syndrome, ACTH, and steroid plus pyridoxine. So, in tuberous sclerosis, if it is very important, they ask us vigabatrin, remember. And vigabatrin side effects is visual field defect. And if it West syndrome, we'll give the ACTH and plus steroid and plus pyridoxine. Second line are benzodiazepine, valproate, amotrazine, pyridoxine. After 2 week EEG will be done if there is any improvement. So gradual weaning from steroid. Multidisciplinary team, I will involve the neurologist, neurosurgery, ophthalmology, cardiologist, developmental pediatrician. So neurologist, neurosurgery, ophthalmology, cardiology, and developmental pediatrician. What are the causes of infantile spasm? It can be idiopathic, West syndrome, hips arrhythmia, infantile spasm, developmental regression, West syndrome, triaris, hips arrhythmia, developmental regressions, and infantile spasm. Then prenatal like tuberculosis, any torch infection, natal birth asphyxia, postnatal meningitis, encephalitis, and head trauma. So these are the cause like idiopathic, prenatal asphyxia, any birth trauma, torch infections, brain bug. These are any developmental regression, tuberculosis. Prognosis improve if without developmental delay, if with delay, bad prognosis. So it depends on the prognosis. If developmental delay not occur, early diagnosis then improve. If not, then improvement not occur. And EEG investigation, remember hips arrhythmia and MRI of brain. And if it is tuberous sclerosis associated, vigabatrin is the treatment. Side effect of vigabatrin is visual field defect. And if it is West syndrome, we give the ACTH and steroid plus pyridoxine. Thank you.